humans on the planet, Dr. Joe Cribbins. Hello, Dr.
Hello,
Joe.
everybody.
We are really excited to try this new platform. We are on a mission to help more people, to reach more people, and to bring amazing practitioners and experts like Dr. Joe together with patients so that we can connect, learn, and grow. And that's what tonight's live is all about. So if you are watching this, drop a comment in the chat. I can see people are here. Hi, everybody. Hello, welcome. We are here to answer your questions. So if you have a question for Dr. Joe, please drop it in the chat so we can see it, and then we'll answer it live. Before we go any further, Dr. Joe, will you introduce people who have not met you before?
So I'm Dr. Joe Cribbins. I'm a bariatric surgeon for the past 26 years, located in Dallas, Texas. I specialize in Da Vinci robotic weight loss surgery and have for some time now. There's a ton of upside to doing those procedures that way. And I am also the dad of Marty, the office corgi.
He's like one of the best office assistants around. That guy knows how to bring the people in. He knows how to make them feel seen. He's on merch.
He does. He loves what he does. It's funny. It comes with treats and belly rubs, and he gets to travel a lot, go to the hospitals, hang out in patient rooms. Yeah, he loves the whole deal.
He loves the whole deal. He's good at his job, and clearly he has a very wonderful life with you and Mrs. Cribbins behind the scenes, making it all happen. All right. Well, let's get into it. It is February. This is a time that people could be thinking about onboarding treatment for their disease of obesity.
Mhm.
Are there things that you're seeing in clinic, in patients? Are there questions that keep bubbling up to the top for you when people are really thinking about onboarding something different?
It's interesting. People usually don't have a whole ton of questions at their first consultation. I mean, they do about, return to work, when can they do stuff with their kids, some details of the procedure. But most patients who are considering bariatric surgery know 1, 2, 3, 4, 5, 6 people in their life that have undergone it, and they've watched that journey for usually months, if not even a couple years sometimes. There's just so much more access to information these days than there used to be, and sometimes it might be Instagram, it might be TikTok, it's not reading journal articles, but there's a lot of good information out there that people tend to dive into. So in general, people are really pretty well informed when they come in for their consultation.
And you bring up a really good point. Like you said, there's so much information now that's out there, and there are plenty of people on social platforms who are documenting and sharing, right, their obesity treatment journey. So you are going to find millions of people who have successfully undergone surgical treatment and are living their life to the fullest. And I appreciate you saying that, because the people who you're seeing in your office and in clinic, they've pretty much made up their mind. This is the road that they want to go to. But you and I both know they could have been on this road for 10 years, 20 years, right? A few years. They have been thinking about this for quite some time. And it's that, right? It's that moment where people realize, I don't want to keep doing it this way. I've tried everything and nothing is working. And it's hard to get to that point, right, where you finally made that decision. How do you make your environment, your office, that first visit as comfortable as you can for people who are probably nervous?
Sure. Well, this is such a big step. It's one of those fantastic, great things in life, going off to college, getting married, promotion at work, those sort of things that are super exciting, and you're really looking forward to it. And you've put a lot of work to get where you need to go. But at the same time, it comes with all the butterflies that all those things have when you sort of are starting that journey. So, oh goodness, we just do so much. I mean, I think it sort of starts with having the right people working in the office.
Mm-hmm.
When you give us a call, Quantica or one of the other ladies will answer this phone. They'll be very, very knowledgeable about all the procedures, about all the process. Many of our patients have undergone this journey themselves. So, from a personal standpoint, they have a connection to the patients, to the journey. Everyone that works in our office works here because they love doing what they do. Like they choose
Mm-hmm.
doing bariatric surgery over working in a gynecologist's office, or other things that you can do when you're working in an office environment. They all do it because they're really invested in it, and they're very good at it.
Mm-hmm.
So however you contact us, whether it's through social media or the website or the email, or it's just a cold call, phone call, you're either going to be getting me personally if it's in an email, or one of the our office people here who really is going to be um, very comforting, very
Yes.
knowledgeable, very
Yep.
inclusive,
Mm-hmm.
non-shaming of the journey. So it just sort of starts there. And when you get to the office, we've worked really hard to make the patient experience from that first phone call through, years down the road, just very welcoming. You get to
Yeah.
walk in. The office is it's nice. It's new. It has very appropriate furnishing in it. Which is
Mm-hmm.
super
Mm-hmm.
important. Sometimes I'll go to the dentist and be like, "My goodness, this would be a problem," for my
Right?
my patient, sort of thing.
Yes.
Um,
Yes.
so you're greeted very warmly. You get to look at all the pictures of all the success stories on the walls,
Yes.
which is
Oh
super
my,
fun.
it was amazing. Oh, I got to visit your office a few months ago and I was blown away because it doesn't feel like any other medical office I've been in. And the first thing that I saw when I walked behind the doors was just walls of patient tiles. These are like before and after, it's pictures of patients who are just thriving under treatment. So you're instantly met with like this village of people who have gone where you have gone before. And it's
Exactly.
so, right? It's so disarming. You're like, oh, okay, I'm not the only one that really needs additional help to, fight my disease. It's the best.
Yeah, like look at all these people that have been here before, and look at their
Yeah.
success stories. And when you get to the room, actually, we have this super cool thing. We have a book of post-op patients that write notes and letters to the pre-op patients. And the
Yes.
pre-op people at their first visit, they just love it. And it's one of those things. It's like so, it's like so simple, but at the same time, like so powerful for those first visit people. Like somebody sat
Yes.
here, took the time to
Hmm.
write this little note. It's going to be
Hmm.
okay,
Yes.
we know you're scared. It's going to be fine, that sort of thing.
Yes.
And then, we really do try and, treat every patient as very individual, give every patient all the
Yeah.
time that they need, all their questions answered. And, we try and bend over backwards for people. And, Chen and I, we do our own cases, we do our own rounds, we answer our own phone calls.
Yeah.
Everybody gets our email, pre-op, post-op. That's just like, that's also very comforting. You have a little, a lot of, some people don't like to use it. They'll still call the office with their constipation questions and things like that. But I think
Oh,
if you're
yeah.
walking around with like a direct connection that's
Yes.
24 hours a day to your surgeon, um, that's comforting and that's powerful. It's just, 3 in the morning, I'm having a little constipation. What should I do? Like, I'll answer in the morning, not at 3, but
Yeah.
hey, yeah, I'm gonna get up in the morning and I'm gonna have like a pretty good answer to like what's going on. So like post-op, that I think that really, really helps people. And we do, try and keep people very close to the office. We do a lot of post-op visits. We have our support groups in the office that people really like. We have one that's living the bariatric lifestyle,
Hmm.
and we have a one that's more kind of dietary focused.
Yep.
Those are super enjoyable for both the information and the community.
Yep.
For
Yep.
people who like to, shake hands and see their friends and sort of stuff like that. It's super useful. So we try and do a really good job at taking care of people.
I would agree that you are not trying, you are doing, and the chat is blowing up with people who are echoing everything that you're saying. You got a lot of patients here watching right now, and they're saying hands down, best experience, best patient experience. Yes, they love The Office, and of course, they love Marty. But
Thanks, guys.
there are there are a lot of little touches that you put into the patient experience that does, you're really thinking about it. You're thinking about that person who's coming into you, who's nervous or scared or unsure or is a little bit, just maybe feeling intimidated to ask you a question because, right, you're the doctor. You're the guy
Yeah.
that has dedicated your life to doing that. And what I've seen you do thousands of times, even on like this kind of platform, you are really able to disarm that fear because very quickly you're like, hey, I'm just a real person. I'm a dad dog. I've got kids, I got grandkids, like you're just very down to earth. And I think they get to know you on these platforms. They get to really understand who you are as a person and as a provider.
Yeah.
And it really, lowers the temperature, which is important. As you know, it's taken that
Oh, for
person a
sure.
really long time, right, to get to this point. There was a question that came in from somebody who's joining us live. They're wondering if you would consider or see countries who live out or people who live out of the country. So do you accept international patients?
Yeah, of course. I mean, it's not super uncommon that people come.
Okay.
Canada, we've had people come from the Middle East. We've had people come from Europe. We've had people come from Asia. I mean, the whole telemed consult now really kind of facilitates that. That you can meet the person, have the conversation, get a little bit of a game plan, get to know each other,
Yeah.
decide what's the best thing to do, and then
Yep.
people will fly in, spend a period of time, have their procedure and then head back home. Yeah, that's really like pretty common.
Wow. Awesome. Okay. Well, that's really good to know. I didn't, yeah, you're welcome, friend. I didn't know that either. I
Yeah.
mean, I guess I just assumed, but it's nice to be able to ask.
Yep.
So I was just at the ASMBS, which is the American Society for Bariatric and Metabolic Surgery, which you are a
Mhm.
member of. They host an obesity summit, and I was invited as a patient, and it was a amazing experience because you just get to know some of the data that's out there around obesity and obesity treatment.
Mhm.
And a big thing that we spent a lot of time talking about was how obesity treatments have expanded, right? GLP-1 medications are a thing. A lot of people have onboarded them. I know you have offered them in your clinic for a very long time, so this isn't really like a new thing for you.
Yeah.
But some of the data that they presented was, right, there are millions and millions of people who are on these medications, and research is showing that there's a percentage of them that will stop taking the medication after a year or two for so many different reasons. So if somebody is watching and listening and they're kind of in this boat, they've been on on a medication and it's not working, what would you do or say with somebody who's maybe thinking about stopping taking these medications but are looking to continue to onboard, right, obesity treatment? Is it instantly a conversation about surgery, or how does that discussion go for you?
Well, it really depends on where they're leaning. And we know
Mm,
now, like when the FDA trials are done, FDA trials are a relatively small number of patients for relatively short periods of time. And basically what they want to know, are medications safe? What's the risk profile? What are going to be the side effects that people will need to deal with? Is this a safe drug that we can share with the public? And do they work? You know,
yeah.
and a little bit of a handle on like how well they work.
Yeah.
So as more and more people have tried the drugs and they've looked at them more in detail with bigger numbers of patients, they have found that the amount of weight that you lose in the FDA trials in the reality is not almost half that much weight.
Oh.
And for one reason or another, whether it's cost, whether it's access, whether it's side effects,
Hmm.
people aren't staying on that drug particularly long. Even if they're planning on doing it for a year, a lot of times they'll come off it before that year is over. So the initial conversation, someone comes in and they're like, hey, I'm on this one drug, but for whatever reason, it's not going well. We may have other options, like a different drug or a compounded drug or something like that, that fits better with what they're needing, or based on their situation, based on their BMI, other things they've done in the past. Is it time to think hard about a surgical procedure? Because in general, like, I love the drugs, they have their use, but if you're putting up the best medical treatment, including the GLPs, to surgery, in general, surgery, you're going to lose more weight. You're going to have less side effects with it. It's going to be much more durable, much more long-term. You're always going to be walking around with your sleeve or your bypass or your SADI for the rest of your life. So there's no way to stop that medication and now struggle against the regain that more commonly than not happens. So we'll start to discuss a procedure based on, their feelings on things a lot more strongly.
Yeah. And really what I hear you saying, and I'm thankful that you're saying this, is that I don't want to say it's to be expected, right? But obesity is a lifelong chronic and progressive disease. And what that means is that, right, there's no cure and it's going to continue to live in your life and impact your life as you age, right? With or without treatment. But the medication can lose its efficacy, right? You talked about durability of surgery. So if you're running into roadblocks and you are on a medication, if it stops working or you're having issues with it, that's okay, right? You are treating this lifelong chronic progressive disease. The next step can be to go talk with an obesity medicine specialist, a bariatric surgeon, about what options are best for you, because it's so easy from like just the consumer side of thing to think that there's only 2 or 3 options. But when you go in and you have a conversation with a specialist, you're going to understand that there are so many more options out there, and they really can be and should be tailored for your individual needs, not only your biology or your genetics, but your lifestyle, the things that you want to accomplish. There's so many factors that go into it, but you're not going to know what those treatment pathways are if you're not talking with a specialist about it.
Yeah.
Does that kind of, right? Like, that's just the best way to do this.
Yeah, exactly.
Okay.
And even if people you've had like, and some people really, they've had a good journey with their GLP, and they're 450 and now they're down to 350, but now it's stalled. And now's the time to consider, changing gears and maybe a procedure at that time.
Yeah. And for me, when you say that, it helps, I think, myself and others take the pressure off, right? Because if surgery is something that you have not wanted to even think about or explore, but you've tried some other treatments and they've just stopped working or they're not working as well, it's nice to know that, okay, I'm going to go talk to you, but it's not just going to be surgery, surgery, surgery. It's really a conversation to get to know you and your needs and how the disease is functioning in your body. And I get it. It's scary to like make that appointment, but I guess what I'm really trying to convey is that you're going to have Dr. Joe on the other side of it. You're going to have somebody like Dr. Joe who's kind, compassionate, caring, understanding, and they really are there to help. Like you spent your entire life dedicated to helping other people fight this disease, and you want to help a lot of people. So it's like a win-win.
Exactly.
Yeah. It's the best kind. Oh, we've had some great questions come in from people who are watching this live. So I'm just going to read them. And then Dr. Joe, if you can answer them, that'd be great. So a question: with the RNY bypass surgery, how much of the weight loss is due to a small stomach size versus malabsorption versus hormonal change? Holy crap, that's a good question.
It is a very good question. It's gonna be different in every person. Like there's not going to be like a straight like 1/3, 1/3, 1/3, because all of those things are working in conjunction. The bypass, your stomach pouch is going to be quite a bit smaller. So that's really going to super help if you could have a much smaller meal and get a nice full sensation from it. the bypass, in the way that it works, it does change a lot of the body's hormones.
Yep.
A little differently than the sleep, but it's very, very similar. You get that good kind of like appetite control. The food noise gets to go away, and then there is an element of you're just not absorbing the calories that you're eating with a gastric bypass. Your
Hmm.
intestines are going to be shorter. So actually, all three of those things are actually super important. And I don't know if there's actually a way to quantify of like which percentage of what is doing, but it's all working towards the same goal of getting that weight
Yes.
off, getting
Yep.
rid of the health troubles, and just getting to like a nice functional healthy weight for people, feel good.
Yeah. Yep. Yeah. And what this question so beautifully demonstrates, and like amazing job that this person really knows their stuff. Bariatric surgery works in so many different ways on so many different levels. And because we're all individuals, right, with different biology, different hormones, different genetics, it's going to respond differently. But it's important to know how many ways the surgery can benefit you, because it's not just a single way. It is
Yeah.
so many pathways, right? Like I know after my bariatric procedure, I was blown away at the brain clarity that I
Hmm.
got. I can remember sitting around and just thinking like, why do I feel like I have so much time on my hands? It's because the disease was running rampant in my brain, taking up like 90% of its ability to think beyond, food. And it was amazing to really start to understand the hormonal impacts it was having on my body and my systems.
Yeah, that's super interesting. Yeah, I mean,
Oh,
obesity I mean, it's a tough disease. You really do want the belt, the suspenders, a little bit of duct tape,
yes. Yeah.
multimodal treatment.
All the things, all the things.
And then
All
everything
right.
outside the surgery, the BariNation, the dietitians, the exercise,
Oh my
everything is
gosh.
important.
Everything is important. Yeah. And again, right? Surgery can be your primary treatment, right, for the disease of obesity. But like every other disease on the planet, it is going to require multiple modalities of treatment. And what we're talking about is you're going to need to throw more than a surgery, more than a GLP-1 at this to be effective.
Yeah.
And the best way that I've come to understand this is my primary treatment was surgery, and I have onboarded so many other things. But what was amazing about my experience is after I had the surgery and I recovered, all of the things that I was doing right before surgery, moving my body, eating whole foods, right, trying to focus on rest, connecting with community, they worked better because the treatment allowed those other things to have a bigger punch, if that makes sense,
Yeah,
right?
for
Before I
sure.
was eating, right? Before I was eating whole foods, but the disease wasn't responding to that diet in a way that I thought that it should have. But as soon as I had the surgery, it was like night and day difference. And I know if you're watching this and you're a patient or you're thinking about becoming a patient, you are doing a lot of things right. You
Yeah.
are already doing a lot of things right. And when you onboard that new treatment, all of those right things are just going to work so much better. And it's just how treatment works.
And that's super common that patients come in to see me for their first, and they'll be like, you know what? I've had a personal trainer for a year. I have a dietitian. I make good food choices. Take my vitamins, my protein levels X. I'm tracking all my foods, that sort of
Yep.
thing. And they're like, but I want you to believe me that I'm actually doing all that. And I'm like, yeah, I know, believe you. Like, I totally believe you. Like, totally believe you. Like, you could, there's some, oftentimes in people who qualify for the surgery, you could be doing so many things right and just not getting the results that you need to get
Yes.
from it. It takes, a just much bigger hammer in your treatment regimen to
Yeah.
get those results. So yeah, people
Yes.
often like, oh, I'm not lying to you. I track all my foods, and I'm like, I totally believe you. You know?
Yes. And I just need to pause and call you out in the best possible way, because there are a lot of people who are just like me who have said those things to countless medical practitioners. I'm doing this, I'm doing that, I'm doing that. And the response that we get from them is not belief.
Yeah.
It's, well, if you're doing those things, then XYZ should happen. And it's really frustrating. So when I hear you say that, even now, right, you are not my bariatric surgeon, but you've had this conversation with me personally before. You say like, I believe you, April, you are fighting a disease. And even I have to be like, okay, yes, like, thank you for not like making me feel about that. But it's just so, for so many of us, we haven't heard that a lot from our practitioners. And I think
Yeah.
it's important to call out that you do believe your patients when they say these things.
Yes, for sure, for sure, for sure.
I know it sounds so weird to call out, but I'm like, dude, I'm telling you, this happens all the time. All right, two more great questions have come in. Well, maybe three. So we'll go a little bit rapid fire.
Okay.
First question is about revisions and whether or not, or maybe a better question is, what are the expectations for additional weight loss that people should have going into revisional surgery? Or does this come back to it's all individual and you just have to kind of try it?
Well, it's going to be a little bit individual. When people come in for a vision consultation, we look at, the patient factors. Are vitamins good? Are proteins good? Are we keeping up with our movement? Are we making some decent food choices? How far have we gotten from the prior procedure? Are we like half the way where we need to be, or do we get all the way and now we're kind of heading back? Is there something in life that we need to sort of like change to sort of, get things moving back in the right direction? Because if you just fix the surgery and you don't fix some of the patient factors, you're not going to get as good results. And
Okay.
so, we kind of look at patient factors a little bit and get those things in line. And then we pick a procedure based on whether we're doing this for some sort of side effect, like is the patient like a very healthy BMI, but they're having reflux with a sleeve or something like that, or is the patient still morbidly obese and we're doing this more for weight loss? We'll pick the different procedures, and then it depends on the effort that the person puts into it. It depends on getting a very good revision procedure at the time of the procedure. So it's going to work well for the patient. It's going to depend on which procedure we choose. Like some people come in and say, well, can I get like a re-sleeve? Can I just make it a little bit tighter? Like, well, we can. I don't know if that's really going to get us everywhere that we need to be. It's just not a fantastic weight loss operation. Or we could do, bring out the bigger, more metabolic, bigger hammer operations like a SADI or a duodenal switch or something, which is going to have a big metabolic impact on people and get, very large weight loss numbers, even in a revision. So it's really kind of individualized.
Yeah. And I know too, just from working and getting to know so many bariatric patients, it can be frustrating when the disease doesn't respond to the treatment methods that you are throwing at it. And I know it's equally as frustrating for you, right? Because you go into every single case and you're working with every person based on their individual needs. And when things just don't quite respond in the way that you want them to, right? But that's the
Yeah.
nature of this disease. It's so pervasive, it's so tricky, it impacts every facet of our life. And the other thing that we have to consider is that you're aging with the disease, and there's things going on in your life that are kind of separate from that disease that can
Yeah,
also impact how effective, right, the treatment methods are.
for sure.
It's a bit of a
Pregnancy is a
shapeshifter.
big one.
Yep.
Menopause can be a big one for people that you just sort of, really have to like hit it harder through certain stages
Yeah.
in life to
Yes.
the good work.
Yes. Yep. And the last question that really kind of came in, if somebody has had a procedure or multiple procedures and is really working to battle weight reoccurrence, which is the proper the right term for what is also regain.
Mm-hmm.
What are the things, or what would you say to somebody that is just feeling like they're not making fast enough progress or good enough progress? That would inspire them to just keep going, because it can feel like a slog sometimes.
Yeah, like especially if someone's, they're out a while from their surgery, and even if you're a year or 2 years out, and you're doing everything right, it can be super frustrating because everybody loses the first 20 pounds in 15
Yeah.
minutes. You know, um,
Yep.
and then after a period of time, it's going to take you 6 months. It might take you a year to lose that 20 pounds, depending on where you are in your journey. But the thing is to just sort of, to keep up to the good things that you're doing. Don't let the scale mess with your head too much, and just, believe in the process, that if you do the things you should be doing and a relatively good job at it, it should still move in that right direction, albeit it's going to be slower at certain stages of people's journey.
Yeah. It is incredibly frustrating. It is just a part of the disease. And I know that we're all wired for those immediate responses. And it's challenging, but just like what you said, we just have to stay the course. We have to really lean into the pillars: movement, mindset, metabolic wellness, community.
Yep.
And we just keep doing the work, even when we're not seeing the results that we're hoping for. A visual that I like to picture in my head when I'm feeling the same way, banging my head against the wall, right? Ice melts at a certain degree, but it's going to take a while for it to get there. And then all of a sudden things change. And when I know that I'm doing all the things that I need to, that I want to, that I'm supposed to do, and I'm not seeing the results, I just try imagining that ice cube. I'm like, April, sooner or later, it's going to start to melt. It's going to get there. You just have to
Gonna
keep
get
doing
there.
it.
It
You're
is.
going to get
That's a
there.
great analogy. I love it.
Right? I know.
Yeah.
Sometimes those things pop into my head and I'm like, okay, this is just what I'm going to have to do to get there. So, Dr. Joe, my friend, we are at time. We've already spent 30 minutes together. We are so thankful for your ongoing support of patients and people everywhere, and especially BariNation. If there's somebody out there that is thinking about doing something differently about their weight, what's the one thing that you want them to know today?
That there's always help out there. There's always help out there, and you need to find a good bariatric team. Take the first step. The first step's always the hardest, but there's help out there.
There's help out there. And friends, if you're watching this and you would like to connect with Dr. Joe, please do so. And if you're looking for a group of people to help support you along the way, there is BariNation. We have an amazing support community where Dr. Joe and his counterpart are often leading. So it's not quite in this live public forum, but you actually get to ask them questions and connect with them in real time. So we're here to help guide you, walk alongside you, because we know, as Dr. Joe said, that first step can be hard, but we are here for you. And Dr. Joe, I just got to say, the chat is being flooded with people who love you. They say thank you. They love their experience with you. I mean, you're a star. You a star, my friend.
Oh, thank you. Thank you. You're funny.
Oh, all right, friends. Well, thank you all for joining us tonight. We will see you in and around BariNation soon. Thanks, friends. And thank you, Dr.
Fabulous.
Joe.
Have a great evening. Bye-bye.
Bye.